Good news when it comes to COVID-19 in Milwaukee County. After 5 months, the county has now moved into the green category when it talks about transmission. Joining us to talk about this is Dr. Bill Hartman, principal investigator for the UW Health Pediatric Moderna COVID-19 vaccine trial. We always appreciate you taking the time. We know you're super busy, happening in a room today to take the time with us. Talk to me about moving into this green category. Obviously, it's good news, but what's the significance here?
Well, it is very good news because it means that the transmission of COVID is finally at a low enough level that many of the restrictions that have already been relaxed can stay relaxed. The reasons for this happening, I think, are somewhat varied. We have a high level of vaccinated people, obviously. We also had a high level of people infected. And so we have a combination of immunity from both the vaccines and from natural infection. And also, the virus itself hasn't been mutating beyond the BA.5 variant very much, anyway. And so the stability of this variant, I think, is very good news for us as we move forward and hopefully get back into a much more normal fall and winter.
Now that the kids have been back in school for about a month now, have you seen any sort of uptick when it comes to COVID cases, or is it just all the other stuff?
There's a lot of other stuff. There's a lot of allergies. It's been a bad allergy season. There's also some other viral cold going around that a lot of people have picked up. I think it's easier for people to pick things up right now for a variety of reasons. But we are seeing a slight uptick in the number of cases, but not in hospitalizations, and things have pretty much stabilized that way.
That is good. That is good news, without a doubt. Really quickly, there's been 2 large studies that have shown increases in terms of the chance of developing type 1 diabetes in children who have contracted COVID in the past. Can you kind of speak to this and just explain this a bit?
So this is from a study done here in the United States, another one done in the UK independently, but they both found the same thing. We know that respiratory viruses are associated with an increased chance of developing diabetes. But when children get COVID, it's even one step further. These children have 2 times that normal chance of developing diabetes. The numbers are still low, but it still shows us we don't want our kids to get COVID, and we don't know what all the long-term implications of having COVID really are. It's just one more thing in this spectrum of long COVID.
It's amazing how much more we've learned in just, the past couple of years. Dr. Bill Hartman, we appreciate you taking the time to be with us this afternoon. Thanks.
Absolutely. Thank you.